CDC started the PRAMS study, which stands for the Pregnancy Risk Assessment Monitoring System, over 35 years ago, and it gives us outstanding data on mothers' experiences in pregnancy in the first year after the child's birth. Really important data like, did the mom access prenatal care in the first trimester? Were they exposed to secondhand smoke? Are they using substances? How is breastfeeding going for them? What was the delivery experience like? Really, really important data that once it's all compiled by the CDC, it represents about 81% of the births across the country. And what happened after 35 years is that the CDC started to get responses in the surveys by the moms saying, why is the only question you ask me about my partner is, did my partner hit, kick, beat, or slap me during pregnancy? And they said, went on to write, the only way I made it through this pregnancy was with the help and support of my partner. So the CDC approached us to say, how would you actually include dads in this survey? What would you ask them? How would you access them? What data do we have on them? That really sent us to the blackboard to figure out what it is that we could do. We did a pilot in 2018 with the state of Georgia that was very successful, that captured dads. We called it PRAMS for Dads at that point. And we got some really remarkable data from there. We learned that dads in Georgia, less than half actually had a primary care doctor, and about 30% or so had actually seen a doctor in the last year. So much smaller numbers than what we know from moms. And that about 10% endorsed mental health symptoms like depression, and about 70% were overweight or obese. So really important data that we have no other data like this in the public health sphere. So this was the first of its kind. And so when we were thinking about other states that might be interested, the Michigan PRAMS team is an outstanding team that does really good work and was ready to take on another project. And at the same time, we learned from Steelcase Foundation that Kent County was a really unique place with a lot of population growth, a very diverse population in general, and a real commitment to understanding the needs of families from a two-generation approach. So when we started working with Steelcase, we discovered that we could actually implement the survey just in Kent County and understand what's happening in fathers and families across Kent County.
So others have mentioned how that dad's voice has not been heard through the 30 some odd years of collecting PRAMS data. And while that's true, one of the advantages to the way that we decided to run PRAMS for dads in Kent County and Michigan generally is that we are linking the survey answers from PRAMS to PRAMS for Dads. There's other PRAMS for Dads programs out there that in other states, Ohio for example, that interviews just the dad, but we find that there will be really interesting data and analyses that we can do and new things that we can find out when we link the information from the parenting dyad, so both the mom and the dad. On top of that, PRAMS has always been linked to some of the information from the birth record. And so linking those three sources of data together, the birth record, which some folks think of that as the birth certificate. It's the information that the Vital Records Office at MDHHS has for all live-born infants in Michigan. Linking that information to the answers that we hear from mom and the answers that we hear from dad can provide us a really rich picture of what's happening with the challenges, struggles, and health care for the mom and the dad in the time around pregnancy.
In my experience and speaking to our interviewers, we've learned that dads are very surprised that any entity would like to hear about their experience in the parenting space. They differ from mom in that they're often overlooked, but have been appreciative that we want to hear their stories overall. So we get a range of comment responses between our paper, phone, and web surveys. Some comments center around struggling with their mental health due to financial constraints coupled with the weight of new and existing responsibilities. Some express pure joy around being a dad, either for the first time or excitement around having multiples, or just how very blessed they feel by it all. And then there are some very passionate about the state of men's health overall, the silence around it, and how often that has a trickle-down effect on the family at large.
So the great thing about Kent County, coming from Wayne County, is that Kent County has the Home Visitor Provider Network. There's a network of agencies that all have home visiting programs. Twice a year we get together and we have a conversation around what those programs are, how they engage, what the referral process is. We try to have a no closed door approach so that all of our fathers, families, mothers, and extended family have access. Some programs go to 5 years, some programs like ours go to 18 months, other programs go to 2 years old. So it's really making sure that as we see a father, they know. A very strong partnership that we have is with Alpha Grand Rapids. And Alpha Grand Rapids has one of the only freestanding men's centers in the country. So being able to connect with them and say, okay, after 18 months, you can go to Alpha. Alpha has clothing, they have diapers, they may have books, they have pack and plays. These are some of the things that you can engage with. They also have mentorship. And being able to have those approaches to being able to connect, receiving a referral from another agency and saying, this father has these issues, and we know that there's a cultural competency piece. Yo hablo español, so yo te puedo decir lo que hay en la comunidad. ¿Cómo vamos a comunicarnos con estas organizaciones en la comunidad? They know that we have that Spanish capacity to speak to a father in their home language, and that is a relief. So many times we go into a home and, no se preocupe, don't worry about it, I speak Spanish, and you just see the calm and the way that they're able to then communicate some of those things they may not feel comfortable with someone who only speaks English.
Greater than 95% of dads are at the birth of their baby. For them, this is a big event. Rightfully so, for many of us who are fathers, this is a really big change in our lives, and we're very excited about it. Dads want to be involved. They don't really necessarily know how to be involved. So they're looking for opportunities, they're looking to be engaged. So some of the feedback that we've got on the survey from Kent County that we've gotten back from fathers actually is, thank you for asking. No one has asked me how I'm doing, and this survey actually shows me that you do care about how I'm doing. So if we can translate that into action on the ground, and action at the state level, and action at the county level, to offer programmings and opportunities for fathers in such a way that they feel supported, then they can be the best father that they can be, and ultimately that helps the family as well.